Hello, and welcome to the Business Council of Westchester Member Spotlight. I am Linda Tyler and your host today. The BCW is the county's largest and most influential business membership organization, offering over 100 events, programs, and panel discussions yearly. I'd like to thank our sponsor today, Tompkins Community Bank. Tompkins Community Bank is proud to support the Business Council of Westchester. For generations, Tompkins has helped the communities we serve thrive and grow. As a community-based financial institution, we consider it our duty to provide innovative financial solutions for local families and businesses as they navigate their financial journeys. At Tompkins, you don't have to choose between business as usual. Instead, choose business accomplished and business accelerated with cash management solutions that help you manage your growing business. Tompkins, your bank of choice. This morning, we're joined by two incredible guests for a powerful conversation on a topic that touches all of our lives, mental health. And we're having this conversation in honor of May, which is Mental Health Awareness Month. With us today are Marie Considine and Damien Travier, Executive Director of Access Psychology Foundation. And Marie, you are the Executive Director of NAMI Westchester. Two leaders making a real impact here in Westchester and beyond. Before we begin, I want to just share a few fun fast facts, or rather, relevant fast facts. And please share and add any others that you'd like to add to the conversation. 1 in 5 U.S. adults experience a mental health issue at some point in their lives. 1 in 20 experience a serious mental health issue, and 17% of our youth, which is really ages 6 to 17, are dealing with some sort of mental health issue. So what we're really finding is if mental health isn't impacting a person individually, it's impacting someone they love or work with, or a neighbor or a friend. And mental health is really, frankly, just as important as our physical health for leading a fulfilling life. I want to hear from both of you today a little bit about your backgrounds. Marie, NAMI Westchester has been a pillar of support in the community for over 40 years. Why don't you tell us a little bit about how NAMI began, who you serve, and what your organization's work looks like today?
Sure. Thank you. Thank you for having us, Linda. NAMI Westchester has been in the county for 40 years, but NAMI, the national organization, was founded a few years prior to that, and by just a few moms sitting around a kitchen table whose sons were diagnosed with schizophrenia and had no idea what to do. They had no support groups. They had no one in their community who would even talk to them. They felt very ostracized. There was no Google. They didn't know where to go for help. So they said, let's just find out all the information we can, do research, and share what we have with one another. So it became a support group around that kitchen table. So NAMI, the National Alliance on Mental Illness, was founded really for the families, to support the families who support their loved one. So now, over the course of the 40 years, it's really expanded. So we now support, educate, and advocate for people who live with mental health diagnoses, as well as their families. So we have direct education programs, support groups, community presentations, etc., and we'll get into that a little bit more. But that's basically what we're doing. We have education programs for young people in schools, support groups for people who live with diagnoses, support groups for parents and families, 8-week education programs so that people understand mental health. And we really advocate for people to get their mental health checked. As we were kind of talking before we started airing today, is that people need to really have a mental health check just like they have a physical health check.
Thank you for the great work you're doing. And Damien, Access Psychology Foundation has also had a great impact on our community. Can you tell us a bit about your background, what inspired the creation of APF, and the work that the organization is doing right now?
Yeah, thank you so much for having me today as well. Thanks to BCW for highlighting the work of organizations that support mental health and provide mental health resources, because it's absolutely important. And those numbers that you cited at the beginning of the conversation, I would suggest, as most numbers and percentages that are out there, they're probably underreported, right? So the problem is even worse than what we might see in the figures and stats and data that's available to us out there. So thank you for sharing those numbers. But the Access Psychology Foundation, and one thing that I love about this conversation is that we're babies, we're new in this space, and we're here with NAMI, who's been a leader in this space for years. And I love that sort of balance and in that approach to this conversation. But we're approaching our 4th year in existence as an organization. And what we do is we provide mental health support resources and training to schools, school districts, and community organizations that work with underserved and diverse populations. We were founded in 2021 by Dr. Alec Miller and Dr. Lotta McGinn, who are clinical psychologists here in Westchester County. They practiced cognitive behavioral therapy and dialectical behavioral therapy, which they know and has been, it's evidence-based, so it's been proven to be effective with underserved and diverse populations. So they wanted to bring the kind of work that they do to more and more individuals and communities that typically can't access it, right? So the Access Psychology Foundation was born, and we have about 4 or 5 distinct programs that we do here in Westchester County and beyond. We're headquartered here in White Plains, New York, and as I mentioned before, we go into schools, school districts, and community organizations and provide training to their staff in evidence-based mental health resources and intervention, so they can then disseminate and disperse that training to the students and youth and families that they work with. We've been partnering with schools and school districts like Ossining Union Free School District and Hawthorne Cedar Knolls School District here in Westchester. We've also worked with organizations like the Boys and Girls Club of Northern Westchester and the YWCA. So we're looking to partner with organizations and schools that already work with the communities and populations that we're trying to impact and support. And we're following the lead of great organizations like NAMI Westchester in trying to bring more and more mental health resources to communities that need it the most.
Which I think is so important. And 2 other aspects that I believe you also, are so important to what you're doing is you're helping teachers, and adults maybe identify kids who really need some added support so then they can take the next step and get that support. And you're also funding scholarships for training in psychology, correct?
Absolutely. For underserved populations, 80% of the mental health resources that they receive come from community organizations or the schools that they attend. So we wanted to make sure that we're providing resources and support to the places where the children already are, right? And another really unfortunate statistic that's out there right now is there's about, for every school psychologist in the country, they support about 1,100 students, which is an untenable a number.
Right.
So we want to make sure that those individuals in those schools are equipped with the interventions and supports that they need to effectively support those young people. We know that, most mental health interventions happen in those moments that are sort of unscheduled, right? When a child is walking from the bathroom to the classroom and they have a moment with the teacher, right, or a hall monitor, or when a child is in the vestibule before they walk into the Boys and Girls Club and they have a moment with, a bus driver or after-school counselor. And we want to make sure that those after-school counselors and those teachers are equipped to effectively support that young person in that moment. Right?
And that is critical.
And that is absolutely critical.
Wow. And there's some training that that's not something that's always instinctive. So it's hugely important what you're doing. Marie, what are some of the most common mental health challenges you're seeing among youth and families in the area? And how are schools and community organizations stepping up to respond, which I think really parlays well into the conversation you and I just had about this.
Right. So we run a helpline Monday through Friday from 9 to 4. And it's not a crisis line, but it's a helpline. So people call us and ask kind of, what do I do? We have a diagnosis. Oftentimes it's a parent. My child was just diagnosed with, for instance, anxiety, depression. My child won't leave his or her room. My child won't go to school. My child has changed their school friends, types of music, what they're doing. They're not doing this, they're not doing that. So what do I do? And sometimes they call us crying and they don't know what to do. Maybe there's a diagnosis, maybe there's not. Oftentimes when a young person receives a diagnosis, that diagnosis can change 2 or 3 times over the next 5 or 6 or 7 years. So what we do is educate the parents, so that they know how to support their young one. By providing the family-to-family program, which is the program I mentioned earlier. It's 8 weeks, 2.5 hours a week. So it's a commitment, but it is a real in-depth education as far as mental health diagnoses, what different diagnoses are, different types of therapies, different medications, not advocating for one or another, just informational, how to put together a crisis plan, how to communicate with your loved one, as well as how to communicate with professionals when a professional is needed. And then also the support groups. But as far as educating youth, we work closely with, with Access Psychology and many other organizations. We have a program that we do in high schools too, and middle schools, called Ending the Silence. And that's really, in a nutshell, is what it's about, is that we need to talk about mental health. We can't keep it inside or we won't get help. So the Ending the Silence presentation is given by people who have lived experience. So it's a 2-part presentation.
So important.
One is, the first part is usually taught by a parent who has experience bringing this loved one of theirs from diagnosis to recovery, and probably has gone through our family-to-family program and has really learned what it takes to support their young one. And then goes through a PowerPoint, some videos, talks about mental health warning signs, suicide warning signs, helps young people identify a trusted adult, because like Damien said, it could be anyone. It could be the bus driver. It could be the coach. It could be your faith leader. It could be a parent's uncle or aunt. It really can be anyone. So therefore, we all need to know this information too. And by the way, we do this Ending the Silence presentation for PTAs and for faculty and coaches as well. The other part of the presentation is a young person, someone who's younger than 30, who's been through their own journey and really shares their personal experience. And that's when you can hear a pin drop.
With the light on the other side, that you can get better and you can get help. So it sounds, which is so critical, twofold. You're providing a roadmap for parents or family members or loved ones who are trying to help someone they love who has a diagnosis. And you're also really educating people about how to deal with it and how to recognize different symptoms. Damien.
Linda, can I mention one thing
Sure.
about what Marie said? I think when she said that they train and support facilitators that have a shared lived experience, I want to just lean on that for 1 second, because it's very, very important. We work primarily with diverse populations, right? And there's a long time stigma, right, to individuals from communities of color or underserved populations, whether it's LGBTQ or rural populations, to get this kind of support or request this kind of support. So sometimes it's important for the facilitators, the clinicians that go into those spaces, into those very vulnerable spaces with these people, to have a shared lived experience or to have some kind of cultural competency. So one of the things that we do at Access Psychology Foundation is we have a scholarship for individuals from diverse populations that are emerging clinicians, right? That are at the graduate school level, at the postdoctoral fellowship level, and we provide a generous stipend to individuals from communities of color, underserved populations who are about to become members of the mental health sort of practitioner landscape. We want to make sure that we're diversifying the labor force that is going to be bringing these services to these communities, so that there is this connection that is there, and that the impact is that much, it's felt that much more greater.
And that's great work that you do to support, as you've said, emerging clinicians so they can continue their studies and move forward. And the education and awareness that both of your organizations are doing is critical.
One of the, if I just may add to that, you just reminded me, another presentation that we do is called In Our Own Voice. And that we do oftentimes in college classrooms and in graduate school classrooms. Even some nursing schools locally bring us in. And that's a program where 2 people who are adults and are in recovery share their personal journey of diagnosis to recovery, how they got there. Because it's sharing that lived experience to show this is what it takes. It takes years. It takes a lot of self-advocacy, self-education, and a community. We say it takes a village to raise a child. It certainly takes a village to get from diagnosis to recovery. And whether that's your given family or the family that you create.
Absolutely.
And what you're providing, both of you, is a roadmap, your organizations, and also that hope that you can get better. You can feel better. You can recover and recover well. But everyone needs the help and the support, just like any illness. Damien, APF is doing powerful work around advancing mental health equity. You touched upon that a moment ago. Can you share what makes your approach unique, and how are you addressing the gaps in access to care for underserved communities here in Westchester?
Yeah, thank you for that question. I think what's unique about the work we do is the length of the partnerships that we have with the schools and the organizations that we work with. Right, we don't just go in and do a 4 or 5 day training. We stay with them for 2 years of ongoing consultation to ensure that they can disseminate the training to fidelity amongst their population, amongst their community, whatever that may be. We also stay there to help them train new staff that may have come in since we did the original training. And we also help them work through acute or unique situations they may be facing at the school or community organization level. Maybe there's a family that they've had difficulty really supporting in the right way, and they're looking for that kind of additional support. Maybe there's a child that has a unique situation that they don't feel equipped to address from a clinical perspective, and we stay on to help them through those issues. So the training is impactful and important and urgent and unique. But the way that we stay there with the organizations for 2 years plus is what I think really helps the organizations really make a difference in those communities. And over the 2 years, in the number of schools that we worked with here in Westchester County, some of them I mentioned earlier, we've impacted over 11,000 students through that training and through that work. And we are looking and are excited to impact 11, 12, 13,000 more in this year in 2025.
That's incredible, the numbers you're reaching, and that says you're really, really making a difference. And I think the length of the program says a lot too, because it is a process, and you really want to make sure people are very well educated and prepared once they've finished. Looking ahead, this question really is directed for and towards both of you. What do you both see as the biggest opportunities or needs for strengthening the mental health system in our area? And how can the business community be a part of this solution?
Well, I'll start. Well, I think the important thing, and one of the beautiful things about Westchester, and you see me and Marie here, is collaboration, right? I think it's important for organizations, like-minded organizations, to come together and work together to tackle these important issues. A lot of times organizations kind of work in silos. Sometimes you have to compete for funding dollars, so there's that kind of competitive nature in that respect. But I think it's important for us to kind of look beyond that and partner and form real partnerships. And I think Westchester County does a really great job of doing that. I think the business community is important in that respect as well. There's some uncertainty around funding in the country, and it's important for the business communities to kind of get behind these nonprofit and community-based organizations with financial support, with knowledge, with the thought partnership as well, because they have a reach that oftentimes our organizations don't have, right? From a funding perspective, but also from a capacity and people perspective. So those kind of partnerships and collaborations from both a programming perspective, but also a funding perspective is very important for us.
Absolutely. Marie?
Very well said, Damien. What I'll just add is that, especially with Business Council of Westchester and all the member companies and businesses and organizations, bringing, for instance, us in NAMI Westchester in for a presentation. We have something called Stigma-Free Company. So it's really a mental health education, and it shows to the participants, who are the employees, that the organization, that the company really supports mental health. So making sure that your health insurance plan includes behavioral health. That's something that's very important. Oftentimes when we get calls from people say, I can't find a therapist, I can't find a psychiatrist, there's no one I can get to. It's said, have you checked your health insurance plan? Oh no, does that include some time with mental health treatments? Yes, it does, usually, but often not enough. Many times, especially nowadays, providers are not accepting insurance. So oftentimes people have to go out of network. So increasing those limits and making sure that a higher level of number of sessions are included are very important. It's a way to support your employees, and also do it visibly, not just behind the scenes. Let your employees know that you support their mental health. Give them time off if they need time off, and have your door open for them to be able to be vulnerable and be honest.
And that
That's
really
great.
goes back to what we're saying. Mental health is just as important as physical health. If you have a broken leg, you're going to treat your broken leg. And if
Absolutely.
you have a mental health issue, you should treat that as well. Let's talk about a powerful and sobering subject, which is suicide, which used to be a very taboo subject. Thankfully, we're learning how to talk about it more openly. Marie, what do we know now, and Damien, about how to approach this topic and what is currently being done in Westchester to support prevention?
Sure. Years ago, no one would talk about suicide. It was not a word that was used growing up. And nowadays you do hear about it, but how do you hear about it? In a TV show, in the news, it's something that we need to make more normalized in terms of, if you see something that even makes you raise your eyebrow a little bit on social media or in conversation, or you're overhearing, or someone mentions something, if you just get that little inkling of, do something about it. Don't hold back. You don't have to be the one to know everything, but I would say we all have the power and the ability to save a life by just asking a question, starting a conversation. Are you okay? Do you want to meet for coffee? Do you want to talk? Are you going through something? Just open that door, because then you can hand off, you can get help. Don't be afraid. I mean, years and years ago, the thought was, don't mention that. You'll plant the seed.
Yeah.
You'll plant the idea. No. Research has found that that is not the case, that it really opens the door for that person to just be vulnerable, maybe break down in tears and be honest and really get the help. So then it is incumbent upon us, I feel, is that we all should know what to do next. And what to do next can mean a lot of different things. You can bring in that trusted adult, that trusted person. You can call on organizations like ours to get help. Also, everyone needs to know what 988 is. It's a 3-digit number. Everyone should know just as well as 911. You can call or you can text. And not just if you are in crisis, but if you have a question about, I wonder if so-and-so did something that may have, kind of raised a red flag. I wonder if that's questionable. You can call or text it at any time and get that information and get resources. I'm a co-chair of the Westchester County Suicide Prevention Coalition, which is comprised of individuals and organizations who are all working toward bringing the suicide number to 0. And we've created a healing garden, which is in a Westchester County park, Ridge Road Park in Hartsdale. And this is a little sanctuary that's in the park dedicated to families who've lost someone to suicide. And you notice I'm saying lost someone to suicide, not someone who is committed. Language matters. We don't use the word
Very true.
committed. It's very connected to crimes. In some religions, it's connected to sins. We say someone died by suicide. That's a factual statement describing how someone died. So take that judgment out of your language, and you'll be able to support people. One of the things that I'll mention, and I want to hand off to Damien, is that the Suicide Prevention Coalition is working with all these other organizations and starting this initiative, not only the Healing Garden, but we started something this year called Chalk the Walk, Have the Talk. So the idea is to draw a design or a message with chalk on the ground, on a sidewalk, on a piece of paper, it doesn't matter where it is. Take a picture of it, upload it to the Westchester Suicide Prevention website, and then that's a way of raising awareness. 20 of the signs will be made into lawn signs and displayed around Ridge Road Park. But also the other part is, like we're doing here today, is having the talk about mental health, about suicide prevention. So that's one of the things that we're doing. And also advocate. Become an advocate. Learn what the initiatives are. We're trying to advocate for barriers on bridges to prevent suicide, for a 988 trust fund so that 988 doesn't go away with funding cuts, and becoming a presenter in one of the programs. So those are some ways to kind of save lives and not only talk about suicide, but really hopefully prevent it going down the road. I'm sure Damien has something.
And what
say.
would you like to add to this?
No, I'll very well said, and not very much to add at all. I think you really, I mean, that was incredible. The fact of the matter is, the hard truth is, suicide for young people is on the rise. Post-pandemic, social media, as Marie mentioned, just the uncertainty in the world over the last, few years, has caused suicide to rise amongst teens. That number is that much more higher for our young girls and for communities of color, LGBTQ as well. And it is absolutely important for us and organizations like ours to help introduce these kind of interventions to young people at an early age so they begin to develop and build the resilience and the tools to combat the things that might cause suicide ideation. And I think we're doing that right now.
I think you're both doing an amazing job. And that what I'm hearing you both say is don't be afraid to talk about it. The work you're doing is making a huge impact. And thank you both. Thank you both for being here, for sharing what you do, the messaging. Please go, for those who are listening, to the websites to learn even more about the great work they're doing. This is a quick reminder that the Business Council of Westchester is the county's largest business membership organization with over 1,100 members who are active businesses here today in Westchester County and beyond. We are very good at connecting our members and helping them showcase their mission, their statements, their businesses, and what they do. And thank you both for being our guests today, especially in such an important month in May.
Thank you so much for having us.
Thank
Appreciate
you.
it. Thank you to
pleasure.
BCW.
Giving voice to this topic. Thank you.
Be sure to check out the BCW Podcast Network's expansive lineup of shows: Leadership Unleashed, What's Trending, Advocacy and Politics Unplugged, The Member Spotlight, and Nonprofit Voices of Impact. The Business Council of Westchester is the county's largest business membership organization focusing on economic development and advocacy. With over 1,100 members, it is our mission to work for the profitability of our members and the prosperity of the Westchester community. To learn more, go to thebcw.org.